Welcome to Diet Talk with Dietitian Michelle, your food expert. This is a diet program where we talk about food and how food affects our health. I am Michelle Umadi, also known as Dietitian Michelle. All right, so today is MNT series. Have you heard about that before? MNT simply means medical nutrition therapy, and that is the service that dietitians provide, and not food rationing service or diet plan only, where you say, Dietitian Michelle, give me diet plan to make me fat, or give me diet plan to make me slim, give me diet plan to make me healthy. Now, what we offer, the service we offer is called medical nutrition therapy, and I have dedicated one series, which is one Tuesday in every month, one Tuesday on Diet Talk with Dietitian Michelle. I'll be talking about medical nutrition therapy to help you understand who we are and what we do. So there will be case studies, practical case studies, real clients that we have managed at Citadel Nutrition Consult. I will share with you the case, and I'll share with you the therapy we implemented and the success story. So that is what I'm going to be talking about on the MNT series, which is Medical Nutrition Therapy series of Diet Talk with Dietitian Michelle. Now, we have managed many conditions ranging from diabetes to hypertension, cancer, kidney conditions, many diet-related conditions. But for this year, MNT series, it will be mainly on overweight, obesity. Cases of overweight and obesity that we have managed. I would help you understand their situations. Perhaps it might be the same thing you're struggling with, and what we have done would help you in achieving your goal. So remember, this year the focus will be on what? Medical nutrition therapy applied in the management of overweight or obesity. I hope you're ready. But before we begin, I would like to know your take. When you hear, this is a dietitian, what comes to your mind? Do you even know who dietitians are? Do you know the services we provide? Do you know what dietitians do? Would you recommend the services of a dietitian? Because I'm eager, I'm curious to know, when you hear, oh, this is a dietitian, what comes to your mind? That we can cook healthy foods, or we can portion foods, we can ration food. Is that what comes to your mind? Don't worry, by the end of today's episode, I'll know if it's the same thing that you are thinking. And I also want to know, are you one of those who will tell somebody, oh, you have a diet-related condition, you have diabetes, don't worry, just eat beans and unripe plantain and you'll be fine. Avoid sugar, and that is all. You don't need to waste your money on dietitians. You don't need to waste your money going to consult a dietitian. Is that your kind of person? Is that what you think? Or you genuinely feel that people who have diet-related conditions like diabetes would need to see dietitians? Anyway, let me tell you what I have observed. In Nigeria, in fact, even in Africa, everywhere, the services of dietitians are not well known and appreciated. People don't really know what we do, which is why I am focusing on this particular series. This is why I am talking about medical nutrition therapy. You know why? Because it has cost many lives. People have died who should be alive. Why? Because they neglected the role, the importance of medical nutrition therapy. Yes, and I am here to help us change that notion, that perception on how we see dietitians. In fact, permit me to say at this point, and I'm really sorry for those that it will offend, but I have also come in contact with medical doctors, physiotherapists, health professionals who should recommend or refer their patients to see dietitians. But because they truly don't know what we do and the benefits of our services, they just don't bother. Some might just tell the person, oh, just eat this or eat that. They give them what we call guidelines. And guidelines are not the same as medical nutrition therapy. Some might even say, oh, well, dietitians are expensive. The person has not even seen enough money to eat food. How much more consulting a dietitian who will ration their food? Is rationing what we do? No, it is not. There are times when we will need to reduce portion control, and there are times when we will need to increase portion control, depending on the nutritional condition, depending on the condition we are trying to manage. So, do you know who dietitians are? Do you know the services provided by dietitians? Will you recommend the service of a dietitian? And if you are a health professional and you do not recommend or refer your patients to see dietitians, it simply says that you are ignorant of the services of dietitians, what we really do. And I hope that this episode and many other episodes in this series of MNT will help you understand who dietitians are, not just the health professionals, but even you, my dear listener, listening to me. I hope that by the end you would understand what we do, who we are, and how we can help our clients, so that when you see somebody who has a health condition, you will tell the person, oh, you have a diet-related condition. Have you seen a dietitian? Have you consulted a dietitian? Because we need to see the person. We need to assess the person. We need to know the medication the person is taking. We need to know the right diet to plan. So I hope that by the end of this episode and many other episodes under the MNT series, you will know who dietitians are and what we do, and you will be able to refer and recommend the services of dietitians. That is the whole essence of this particular episode. And for those who will be wondering now, what are diet-related conditions? I'll mention some and you can also research. Number one is we have diabetes. It's a diet-related condition that responds to diet therapy. We also have obesity, overweight. Those who need to lose weight will benefit from diet therapy. Underweight. Yes, it is a diet-related condition that would respond towards diet therapy. Hypertension, some say is just a symptom, but well, as long as it responds to diet modification, we still classify it under a diet-related condition. Then high cholesterol, although in some countries they say there is nothing like high cholesterol, but until health organizations come together to say it is no longer a diet-related condition, for now, we still regard it as a diet-related condition that responds to what? Diet therapy. Cancer responds to diet modification. Kidney conditions. So you need to see dietitians to help you plan your diet. Anemia is also a medical condition that responds to diet therapy. Arthritis, especially rheumatoid arthritis. Then cardiovascular diseases, we have stroke there, we have heart attacks and many other CVDs. These respond to diet modification. Liver conditions too. So these and many other diet-related conditions respond to diet therapy. So I encourage you, if you know someone or you are even a caregiver or someone who has any of these diet-related conditions, ensure that you see a dietitian for a proper nutrition therapy. I'll tell you more about medical nutrition therapy and help you understand what we do when we say we are providing a service called medical nutrition therapy. This is the MNT series, which is medical nutrition therapy, where I talk about the various case studies, the clients, conditions that we have managed at Citadel Nutrition Consults. All right, so I'll share with you the condition, I'll share with you the diet plan and the success story, so that you would understand the role diet plays in the prevention and the treatment of diseases. So real situations, real conditions, not downloaded from the internet or even forged, but real situations on how we have used medical nutrition therapy to achieve success in nutritional management. All right, so that is why we have this series, to help you understand who dietitians are, what we do, and the real meaning of medical nutrition therapy. So to help you understand medical nutrition therapy, before I share practical case studies from the next episode, I would give you just 5 diet-related conditions and give you a clue on the medical nutrition therapy that we provide. And these conditions are diabetes, cardiovascular disease, kidney condition, obesity, and underweight. Let me just give you a brief summary on what we do in the management of these conditions. Now, in diabetes management, it's not one size fits all. So if you have a hospital where you give out one diet plan to every patient who has diabetes, then you're getting it all wrong. You're getting it wrong because it needs to be customized. Diabetic patients are all different people and they have different medications, and there are many factors that will determine their kind of diet. Are they hypertensive? You have to put that into consideration. Are they at risk of developing a kidney condition? The dietitian has to put that into consideration. Is the person on insulin or just oral hypoglycemic drugs? You have to put that into consideration when planning the diet. So if you have been given a diet plan without proper consultation with a dietitian, then you are on the wrong track. Now, let me explain what we do in the management of diabetes. The major nutrient of concern is carbohydrates. And where do you get that carbohydrate from? From the air we breathe? No, definitely not. It's not from the air we breathe. It's not oxygen. We get carbohydrates from the foods that we eat. And if carbohydrate is the nutrient of concern in diabetes management, then to get it right, you have to be able to eat the right amount of carbohydrate to help your medication work. In summary, the major nutrients that dietitians modify in the management of diabetes is what? Is carbohydrates. Now, for those who are even on insulin, have you heard about what we call insulin carbohydrate ratio? Has a doctor mentioned that to you? If not, then you need to see a dietitian. Let me help you understand that. Now, those who take insulin, we are supposed to put into place what we call insulin carbohydrate ratio. For example, 1 unit of insulin should work on 10 to 15 grams of carbohydrate. You can see that it's even a range. It's not even static. It's not even one figure. Because if I have a client who is very young, a very young child, I would use 15 grams in planning the diet because the person is young, the person is active, the person might be taking a high dose of insulin. So all these would determine the amount of carbohydrate. But if I have an elderly person who is on insulin, then I'll use the lower figure because the person is not active. So you can see that is a range. Now, if that person who is supposed to be taking 10 units of insulin ends up taking 50 grams of carbohydrate instead of 100 to 150 grams, do you know what would happen? The person's sugar would be so low and might even lead to coma. That is not right management. So you need to match the carbohydrate with the insulin that you are taking. And let's say that you're even on insulin and you eat as much as 200 grams of carbohydrate. I have heard people say, after all, I am on insulin, therefore I can eat as much as I can, but that is wrong. If you're taking, for example, 10 units of insulin and you eat as much as 200 grams of carbohydrates from your food, that insulin shot will still not help you achieve results because you are eating way more than it should work on. And so the sugar will still be going up and down. Let me tell you, in the absence of diet therapy, using just medication, you can simply liken it with throwing stones in the air and aiming at nothing. So for you to achieve real control in the management of diabetes, your diet has to be put in place. Your diet has to be matched, especially if you're on insulin, with the insulin that you are taking. And that is what we call medical nutrition therapy. It is not downloaded. It is not internet. There's a difference between guidelines and diet plan. You can get guidelines from the internet. You can just go and type, what food should I eat in the management of diabetes? And internet and AI will list out a lot of foods. But to customize it, to meet your own nutrient needs, you need dietitians like Dietitian Michelle. I hope you're clear about the medical nutrition therapy in diabetes management. It needs to be calculated. It needs to be planned for you to see results. Now, how about in the management of kidney conditions, impaired kidney conditions, whether stage 1, stage 2, or stage 3? Just like carbohydrate is a major nutrient we modify in diabetes management, in kidney conditions, it is protein that is the major nutrient of concern. And in calculating protein requirements, there is a range between 0.8 to 1 gram, and in some cases, 1.5 gram per kg body weight. That is calculations. We punch calculator. We don't assume. We don't just imagine. We don't just write things. We carry out calculations. So for a normal healthy person, that is the amount of protein that is recommended. But for someone who has a kidney condition, depending on the stage, that amount of protein is reduced. We take it to 0.6 to 0.8 gram per kg body weight. So if you're weighing 60 kg or you're weighing 70 kg or you're weighing 80 kg, we multiply that to know the exact amount of carbohydrate your kidney should be able to handle within that period. So it's not a question of, Dietitian Michelle, give me what to eat to manage my condition. There has to be what we call nutritional assessments. to know what is right for you. So it is not a thing of guideline. All right. Now, you need dietitians to help you make sense of it. And in the management of kidney conditions, it is not only protein that is of concern. There are also minerals like calcium, potassium, phosphorus. We need to put that into consideration. We can now tell you the foods that you should eat. Tell you the foods that we call renal-friendly diets that you should eat to help the kidneys to get well. You need to see dietitian. If you know someone who has a diet-related condition or you have a diet-related condition, the earlier you see dietitians, the better. Have you heard about cardiovascular disease like heart attacks, strokes, and the rest? These also benefit from medical nutrition therapy. Now, you can call it medical nutrition therapy. You can also call it diet therapy. So in the management of cardiovascular disease, the major nutrient is what is fat. That is what we look at. That is what we calculate. That is what we are trying to modify so that you're not eating a lot of saturated fats. We help you get it right. And in some cases, there can also be a need to modify the sodium content. For normal healthy individuals, we recommend 2,500 milligrams of sodium. But for those who have uncontrolled hypertension, we say, please bring it down to 1,250 milligrams per day. Do you know how to go about that? My guess is no. So you need dietitians to help you make sense of it, to help you calculate your diet, to help you customize your diet, to help you get it right. How about obesity? For weight loss, you also need the help of dietitians. Now, for diabetes, it's carbohydrates. For kidney conditions, protein. For cardiovascular disease, fat. But for obesity or overweight, it is the whole three put into consideration to reduce your caloric intake with focus on sufficient amount of protein, which is why some people hit the gym, cut down their foods and all of that, and they are still not losing weight. If you're not getting the right amount of protein for your weight, you are not going to see the results that you desire, because in the end, you're just going to be starving and your body will be trying to protect you from that starvation. So obesity, yes, requires what we call medical nutrition therapy. And then for those that are underweight, you need a high-fat, high-protein diet. It's not a matter of that. Michelle, tell me what to eat to gain weight. Haba. We have passed that level. You need a proper assessment so that we can plan the right diet for you to achieve your results. So, my dear listener, I hope I have convinced you that dietitians are relevant, important in the management of diet-related conditions. It is no guesswork. It is not internet downloaded diet plan. We calculate, we plan diet based on the medical condition. This is evidence-based practice. We are not guessing, all right? So when you see someone who has a diet-related condition, will you recommend the services of a dietitian? This is still Diet Talk with Dietitian Michelle, and today on MNT, which is Medical Nutrition Therapy, we are talking about dietitians, who we are, and the services that we provide. I just talked about diabetes and what we do, cardiovascular disease, hypertension, obesity, kidney conditions, and the therapy, the diet therapy that we provide to achieve results. So I have seen firsthand the benefits of medical nutrition therapy. I'll share my own story with you too. My grandmother died at the age of 72, heart attack. And do you know her favorite food? Her favorite food, egusi soup. All right, and then banga. Now, I am not saying that those who like egusi and banga will die of cardiovascular disease. No, that is not what I'm saying. All I am saying is if only I knew what I know now, probably she may have still been alive. All right, because at 72, she was really looking fresh, just that she was morbidly obese, and then she liked the wrong kinds of foods, and we didn't know how to help her. And she was going to the hospital, getting medications, getting treatments, but there was no help. There was no guide as to her food and her diet and how to go about it. Okay, fast forward now, my mom is 70. I am not going to take out the God factor because, God is involved here. He has helped and he's helping. My mom is 70 and she does not even have any signs and symptoms of cardiovascular disease. So do you agree with me that medical nutrition therapy is key? Do you agree that diet plays a very key role in the management of diet-related diseases and even in the prevention? Yes, some will say it runs in our bloodstream. That does not mean that you must come down with it. It is called preventable disease. Why is it called preventable? It can be prevented. Share your thoughts. Let me know what you think about dietitians, our services, and if you're going to recommend. Let me also share that my own dad is a prostate cancer survivor. 10 years and we are counting. To the praise and glory of God, you need to pay attention to your diet. What you're eating now can either make you or mar you. So what are you eating? What is your food? What are you eating right now? Diet is key, both in the prevention and in the treatment of diet-related diseases. You can join the conversation here. You can drop a message and we will respond. Who are dietitians? What do? We offer a service called medical nutrition therapy. And we are key. We play important roles in the management of diet-related conditions. I already mentioned some. If you are not clear, I'd like you to still browse, Google about it, ask AI, what are diet-related conditions that will benefit from diet therapy or medical nutrition therapy. I hope I have made it clear on who dietitians are, what we do, and the service we provide. It's beyond cooking and cooking healthy foods. It's more than give me diet guidelines. Some will just come to our DM and say, give me the list of foods to eat. Some will say, give me diet plan that I will follow. It's more than that. Now, we have diet plans on our website, but we consider this first aid. Just the way you would take paracetamol before you get to see the doctor. That is the same thing we do. So we have just regular, normal, healthy diet plans for family meals, for those with diabetes, but you still need to see the dietitian for a customized plan that would help you achieve your results. So before then, that is when you can have access to any of the diet plans that we have on our website. I'm very glad we had this conversation because it can form the foundation for the many discussions we're going to be having. So when I bring up a case study, you will be able to follow, because now you will know that it's not give me guidelines or give me diet plan. Proper medical nutrition therapy used to achieve success. Now, how can we help you? How can dietitians at Citadel Nutrition Consult, which is where Dietitian Michelle works, how can we help you to achieve your own health goals? Remember, it's not just for treatment, but even in the prevention of diet-related conditions. You can schedule a consultation with a dietitian for yourself or for your loved ones. All right? So all you need to do is to call our phone lines. I'm sharing with you Dietitian Michelle's office line now. You can send a message, consultation, to 0708 987 3497. 0708 987 3497 or 0904 675 8079. 0904 675 8079. Please do well to send a message, a text message, or WhatsApp. Send a message, just send consultation, and we would guide you. We have many packages. We have packages ranging from 10,000 naira to 360,000, depending on how you want us to be involved. Just consultation, or you want consultation with customized diet plan, or you want consultation with food products, or consultation with monitoring, or even consultation with dietitians as your accountability partners, people to guide you, to watch you, to answer your many questions concerning your diet. So just pick any plan, but start from somewhere. You mustn't just pay for yourself, even for your loved ones, for your family members. Enroll. Tell them you need to see a dietitian. The earlier the better, to prevent complications of these diet-related conditions. And if you live in Jos, you prefer to see dietitians face-to-face, one-on-one, you can come to our clinic, Citadel Nutrition Consult, that is located at Crispon Hotel, opposite Air Force Base, off John Ajang Expressway, Rayfield, Jos, in Plateau State. That is our physical location. Now, for our consultation, we know that there are some people that are too busy to leave their workplaces, and so we also provide what we call virtual consultation. You don't have to leave your home or even your office. You can schedule for virtual consultation. Yes, we are not doctors who need to touch your body, your temperature, and all of that. No, we just need to understand your lifestyle, know the medical condition, and we'll be able to plan your diet and send to you. And if you even have food products you have paid for, even that can be sent to you. So you can schedule your virtual consultation. Go to our website, www.citadelnutritionconsult.com, and you will see the option to choose virtual consultation, and we will attend to you. If you're still not clear on how to get this virtual consultation, still, you can send a message to our number 0708 987 3497 or 0904 675 8079. Just text and we will get back. We would ask you what you want and help you choose or pick a plan. I have another good news for you. I have online courses recorded by Dietitian Michelle and other dietitians that work with me at Citadel Nutrition Consult on diet management of diseases. Not more than 2 hours, especially for those who will insist, oh, it must be Dietitian Michelle. It's Dietitian Michelle that I want to consult. Well, I'm available for consultation. You'll be told Dietitian Michelle's plan, but you can also start from these online courses recorded by Dietitian Michelle on diabetes management, on how to lose weight, on child nutrition, or even nutrition in pregnancy. You will find that on my own website, which is www.dietitianmichelle.com. When you get there, you will find our courses there explained, and it even comes with free recipes that you would enjoy and diet guidelines that would also guide you. All right, so you can go there and get any of the course that would help you understand the nutritional management of a diet related condition. Now, for partnership, we can also partner with you. Are you a doctor? Are you a director at a hospital? Or do you own a hospital and you don't provide medical nutrition therapy? You want to provide excellent service? We're open. We can collaborate with you and provide medical nutrition therapy. We already have our system and structure that we use in consultation that has given us excellent, fantastic results. You can check our reviews on our website. So if you have a hospital, a health insurance company, a gym, a hotel, and you would like to partner with Citadel Nutrition Consult to provide nutritional service, we are open. We will be very much available to collaborate. And if you're wondering how we are going to cope, we have over 50 dietitians in our network that we have already trained, and they are ready to provide excellent nutritional service. So either physically or virtually, we can collaborate. We're in partnership with many hospitals in Port Harcourt, like Paragon Clinics and many other companies that we manage, and even here in Jos, like Refit Medical, Zenith Life Foundation. We are in partnership with them to provide medical nutrition therapy. So you can call us, or even gym, like the gym at Crispan. We are in partnership with them to help clients to see results that they desire. So call us for partnership and we'll be very happy to collaborate. So I'd like to thank you for joining me today on Diet Talk with Dietitian Michelle. I hope you got value for your time, and if yes, I'd like you to connect with me on social media. Let's be friends outside this place. On Facebook, you'll find me there as Dietitian Michelle, Instagram, Dietitian Michelle, TikTok, still Dietitian Michelle, and on Twitter, Dietitian Michi. On LinkedIn, it's Michelle Omadi, and my YouTube channel, Dietitian Michelle. And remember to subscribe so that you get notified whenever there is a new content. I'll see you again on the next episode of Diet Talk with Dietitian Michelle, and until then, I encourage you to make wise food choices. Bye.